Hey, what's up guys? Welcome back to our channel, The Upper Hand. As we mentioned in our last video, we're going to be spending quite a bit of time covering some formal assessments that you may use when evaluating and treating the upper extremity.
So like Dylan just mentioned, in our last video we talked about the dynamometer and how we utilize that in our clinic, as well as some ways to utilize that for validity assessment. So if you haven't checked that out, make sure you go watch that. Today's video is going to be all about pinch strength gauge and how we get pinch strength in our clinic and the different type of pinches that we test. So let's get started.
Alright guys, so today we're going to be using a Jaymar pinch strength gauge. There are different companies that make these out there, but typically we carry Jaymar in all of our clinics. So if you're interested in obtaining a pinch strength gauge, we recommend this one, and we'll include a link below for you to get that. Alright guys, so we're going to talk about the parts of this pinch strength gauge. We've got the button here where the patient will actually press to measure pinch strength, then the needle that you see moving there. There's also a second needle similar to the dynamometer we talked about in our last video. There's a second needle that will stay in place even after the force comes off, so there's no need to remember where that needle was at when they were applying max pressure there. And as you can see on the face of this, there's a kilograms of force and a pounds of force. If you're using the metric system, obviously you'll be wanting to use the kilograms of force. So we typically use the pounds of force in our clinic. And so now we're going to jump right in and show you what it's like to actually test pinch strength.
Okay, so let's go ahead and talk about the three different positions that we typically use. One being a lateral pinch, like this. Another being a tip-to-tip pinch with thumb and index finger. And then also a three-jaw pinch with two fingers on top, thumb on the bottom. Okay, so when you're testing someone's lateral pinch, I typically like testing the opposite side first. That's not necessarily the way you have to do it. That's just what I like to do to give the patient a feel of what's going to happen when they squeeze down on the button. So I'll ask Dylan to make a fist. I'll place the dynamometer right on the radial aspect of his index finger, right kind of around the proximal phalanx area, maybe even over the PIP joint. Ask him to go ahead and squeeze as hard as he comfortably can and relax. You got 30, 31. It's really good. Then I'll go ahead and ask him to do the same thing on the right side. We'll pinch again. And Dylan is right-handed, and he did have more pinch strength on that side, which is typical. All right, so the next position we'll talk about is a pincer grasp or a tip-to-tip grasp. I'll be honest, I don't typically do this during an evaluation unless maybe it's an index finger injury and then I want to know exactly what we've got there. But typically I go straight to three jaw. But for the purposes of this video, we will go ahead and talk about the pincer grasp. So I'll ask Dylan to go ahead and put his thumb on the bottom, index finger on the top. Go ahead and ask him to, first I need to make sure this needle is all the way to 0. And go ahead and ask him to squeeze. Very good, 16.5. Same thing, we'll go to the other finger, the other hand, squeeze, and again, more on that dominant side, which is typical at around 20 pounds there. So the last way we will test, or the last position that we will test for someone's pinch strength is a three jaw. So I'll go ahead and have Dylan pinch again there. So again, two fingers on the top, thumb in the middle, kind of at a neutral position. Go ahead and squeeze for me. Very good, 26. Same thing, we'll swap to the other side, squeeze again, and around 26 on that one as well. All right, so those are the three positions that we typically test someone's pinch strength.
So you heard Parker mention earlier, when administering pinch strength testing, typically we don't measure pincer strength, although sometimes we do if it's appropriate. And what I mean by that is this. As an occupational therapist or hand therapist, function and occupation are always in the back of your mind, always at the center of what we're doing, right? So with any formal assessment that you administer, once you've gotten an idea of what the patient's leisure pursuits or activities or job demands are on their upper extremities or on their bodies in general, then that will give you an idea, let that guide you as to what formal assessments you administer. So for example, with pincer strength, if someone comes in and they use this grasp a lot, this pinch here a lot, like if they're a mechanic and they're using nuts and bolts, or they're a sewer in a factory setting, then of course pincer strength testing would be very appropriate to test, and you would want to include that in your strength assessment.
Hey guys, thank you so much for taking time out of your day to watch this video. We hope you learned something today and that this was helpful to you in some way.
So our goal for this channel, The Upper Hand, is to give you guys the upper hand as you seek to better understand conditions of the upper extremity and just all topics related to occupational therapy in general.
So please take a second out of your day, make sure you like this video and subscribe to this channel so that you can be sure that you're going to see all of our upcoming videos. Thank you guys so much, and we'll see you next time.